name is Dr. Michelle Loftus. I am one of the hospitalists and physician advisors at North Shore University Hospital. I also serve as the Vice Chair of PICG and the Treasurer of the Medical Staff Society. Originally from Chicago, I did my medical school at Lake Erie College in Pennsylvania and my residency at Lenox Hill Hospital, and I've been at North Shore for almost 5 years now. Currently, I listen to a lot of podcasts and audiobooks, usually driving to work. In the morning, I listen to the daily and get my update on current events, and I have an interest in some financial investing, so I listen to Financial Residency, which I've learned a lot from. From audiobooks, I listen to both some motivational, like Extreme Ownership or How to Win Friends and Influence People, which was given to me actually many years ago in medical school by one of the psychiatry attendings that I was working with, and I found that to be just a very interesting book. So I've listened to that, over the years. And then I just listen to some nonfiction, kind of entertaining, thriller type stuff like The Silent Patient I recently read, and The Lone Survivor. Those are both really good. One of the things I think that has impacted my education and who I am today have been the people that I've met along the way, starting in college with my college friends, and moving to medical school in Pennsylvania, where I met a lot of people who came from all across the country and grew up very differently from I did. They showed me different interests in, more outdoor activities than I was used to growing up in the Midwest, like hiking and camping, and then even traveling to their hometowns and seeing a lot of different parts of the country. It really got me motivated to find out where I wanted to live and what I wanted to do. And then moving to New York City for residency, meeting people who were from different countries or who had grown up in the city, and just all the vastly different interests that they had, it really exposed me to a lot and kind of shaped who I am. And I think just being in a field with a lot of people who are very motivated has kind of kept me going and kept me inspired, and has really made a big impact on who I am today. A lot of the colleagues that I work with now and the attendings that have trained me over the years have taught me a lot of different things that I don't think you can read in books. And so I think it's very important to just realize the people that you're training, or even the people that you work with, and they may have be impacted by you more than you even realize. So I don't think I think it's important not to underestimate that. I would say the COVID-19 pandemic really opened my eyes to how important it is to stay in touch with patients, families, and loved ones. Prior to the pandemic, any families who wanted updates usually came to the hospital. They were at bedside, or the patient would ask me to call them specifically. But during COVID, they weren't able to visit the hospital, and I realized how nervous and anxious all the families were about their loved ones who were in the hospital. And so I actually spent as much time calling families and updating them as I did seeing the patients. And since the pandemic, that practice has kind of continued, and I think it's very important for not only the patients and the family members, but for the care itself, to make sure that everybody's involved and up to date. And I think that has been a big change for me since the pandemic. One of the most pressing issues I see with healthcare today is really access to care. For patients, having to wait sometimes months for an appointment to see their doctor can be very frustrating and delay care for necessary medical conditions. It's also something we see frequently in the hospital, of patients who've had to wait for a long time on the outpatient appointment, and their disease progresses and they need to come into the hospital. Additionally, when you see your physician, sometimes access to medications, tests, procedures require insurance authorization, which can take a lot of time and resources. And I see that is a big frustration, not only for the patients, but for the medical physicians and staff themselves. One piece of advice I would say for doctors in training would be that you're capable of more than you think. I think in terms of learning during medical school and how much reading and studying you did, I learned way more than I thought was even possible. And then residency, working longer hours on less sleep and feeling like you're thrown into a new situation all the time, and then just figuring it out, handling it, and then becoming a new mom also, can survive doing things that you wouldn't expect. So just trust the process and work hard, and you surprise yourself how much you can actually do.